A Guide to Pediatric Blood Transfusions. Imagine you're the nurse caring for a pediatric patient who requires a blood transfusion as a life-saving medical treatment, but the parents refuse. This is a difficult aspect of pediatric nursing that requires specific policies and guidelines to be followed in a timely manner. In this video, we will be discussing what actions need to be taken by the nurse in order to ensure safety of the patient, as well as uphold the legal requirements for this ethical issue. Some patients refuse blood and blood products. In particular, Jehovah's Witnesses have specific religious beliefs regarding transfusion of blood products. A fully informed, competent adult patient is entitled to decide to accept or reject medical treatment, but there are specific legal requirements for pediatric patients requiring life-saving blood transfusions. In all cases involving pediatric patients, the interest and the welfare of the child is the greatest concern. Keeping that in mind, there are 4 different situations involving pediatric blood transfusions we will describe in more detail to give you a better understanding of the actions that should be taken depending on the context of the patient's condition.
Scenario number 1, emergency situation. Let's go over our first example. You are a nurse working in the emergency department and you receive report that EMS is bringing a 6-year-old child who fell off the top of his school's playground and obtained trauma to the left knee and has left periorbital ecchymosis. Upon entry to the emergency department, the patient was found to have a hemoglobin concentration of 5.1. Being from a family of Jehovah's Witnesses, the parents of the patient refused a transfusion of red blood cells despite repeated discussion with the doctor and yourself, in which the real and impending risk of loss of consciousness and death was explained. In this situation, it is important for the nurse to know that in the case of emergency, according to Section 24 of the Human Tissue Act of 1982, physicians have the authority to provide emergency medical care to minors, including blood transfusions, without parental consent or a court order if they have obtained a second physician's opinion that there is an immediate need for treatment. This will happen when the delay required in obtaining a court order would endanger the life or seriously worsen the physical condition of the child. In the case that a second doctor is not available to examine the child, the chief medical officer of the hospital can give the consent for the blood transfusion. The nurse in this situation needs to be aware of this information so that immediate action can be taken to protect the child's life and patient advocacy can be initiated. The nurse and all interdisciplinary members involved must fully and accurately document discussions with the family and examinations of the child with all team members involved in this process.
Scenario number 2, unexpected, previously stable patients. In our second example, you are working on a pediatric ICU and get a new patient who is a 12-year-old female with sickle cell anemia. Her past medical history is significant for multiple episodes of sickle cell crisis, including several ICU admissions for acute chest syndrome. The patient and her family refused any transfusions, stating that they have recently converted to Jehovah's Witness and stated their religious belief that transfusions would deprive their child of eternal salvation. The patient's initial vital signs were stable on her med-surg floor, with an admitting hemoglobin value of 8. She started on an intravenous morphine, antibiotics, and supportive care. Her pain continued despite maximal doses of patient-controlled morphine analgesia. By the 4th day, she is moved to your ICU, when she was noted to be very pale with a hemoglobin of 3.8. She has tachycardia, rising blood pressure, and physical examination that revealed a gallop rhythm and a chest radiograph, suggestive of vascular congestion. This is a very difficult ethical situation that requires specific actions to be taken by the nurse. To begin, the nurse caring for this patient needs to fully educate this patient and her family on the risk involved if blood is not given. If this does not change the family's decision, the nurse will then collaborate with the pediatrician to obtain court orders for treatment that overrides parental refusal. This is done when all alternatives to transfusion have failed and when treatment is required. Death or permanent disability will occur. In addition, the nurse will also contact the hospital ethics committee. A member of the committee can often advocate for the patient and serve as a liaison between the family and patient and the medical team, helping to bridge differences in a non-confrontational manner. The nurse and all interdisciplinary members involved must fully and accurately document discussions with family and examinations of the child with all team members involved in this process.
The operative scenario. In this situation where surgery is planned, this requires a different type of approach for the nurse. In this scenario, we have an 8-year-old child who is scheduled to undergo removal of the appendix. The nurse educates the family that the appendectomy removal process requires obtained consent for the administration of blood products due to the risk for uncontrollable bleeding. If consent for transfusion is refused and is thought unreasonable to go ahead with surgery without the freedom to transfuse, a request to the appropriate courts for specific issue order can be made, which allows a transfusion to be initiated if needed. Where time does not permit application to the courts, blood should be given. Failure to give life-saving treatment to a child could render the doctor vulnerable to criminal prosecution. For elective procedures, a full discussion among the nurse, anesthetist, surgeon, parent, and child, if old enough to understand, is essential. It is important to convey that every attempt will be made to avoid blood, but also convey that a doctor would not allow a child to die for lack of blood transfusion. This situation requires steps be taken preoperatively to minimize or plan for the risk factors that are associated with transfusions, such as stopping anticoagulation therapy, starting antifibrinolytic therapy, or correcting preoperative anemia. In addition, nurses should question the patient on specific blood product interventions that the physician may or may not use. As with all of our other examples, the nurse and all interdisciplinary members involved must fully and accurately document discussions with the family and examinations of the child with all team members involved in this process.
In our last example, we will discuss adolescent patients who are under 18 years old that refuse blood transfusions. In this example, we have a 17-year-old female Jehovah's Witness who requires a blood transfusion due to her diagnosis of Hodgkin's lymphoma and low red blood cell levels. In this situation, the patient is old enough to fully understand the risks and consequences of her decision not to have a blood transfusion. In the United States, there are a few states, including California, that explicitly allow teens to refuse care. In these states, teens as young as 12 can make their own medical decisions. And in situations like this, the mature minor doctrine is used to determine the minor's level of maturity to determine complex health understanding. The doctrine allows teens to get abortions, mental health care, and drug treatment without their patient's permission. In the case of blood transfusion refusal, the doctrine includes things such as, does the teenager live away from his parents and manage his own affairs? Does the teen appear intelligent? mature, conduct himself as an adult? Is the minor married? Depending on all this, the minor may be able to make their own medical decisions. If the minor is deemed to be not mature enough to make their own medical decisions and the family won't agree to a blood transfusion, then the ethical committee will be involved and the courts will be contacted for a specific issue order. For patients who are Jehovah's Witnesses or practice other religious or cultural beliefs that don't believe in blood transfusions, nurses and physicians also collaborate with patients and their families to review any reasonably available non-blood medical alternatives. However, alternative treatments are not always available. If the recommended treatment is deemed medically necessary for the child's welfare by the courts, the transfusion will be initiated. As with all of our other examples, the nurse and all interdisciplinary members involved must fully and accurately document discussions with family and examinations of the child with all interdisciplinary team members involved in this process.
This concludes our presentation. Thanks for listening, and we hope you found it helpful.